year-long working blood glucose measuring device or CGM. However, as a type 2 diabetic for more than 40 years and controlling with foods and oral medication, I don't find this attractive enough. The Food and Drug Administration has approved the Eversense 365, marking a game-changing moment in diabetes care. This is the world's first continuous glucose monitoring system that lasts for an entire year, giving people with diabetes a completely new way to manage their condition. The Eversense 365 changes everything. With just one sensor insertion per year, people with diabetes can now focus on living their lives instead of constantly managing their monitoring technology. The device works for both type 1 and type 2 diabetes in adults aged 18 and older. Here's how it works. A trained healthcare professional inserts the tiny sensor under the skin of the upper arm during a brief office visit. The sensor then sends glucose readings every 5 minutes to a smartphone app for the entire year. The transmitter sits on the skin above the sensor and can be removed and put back on easily, unlike other systems where removing the transmitter means losing the sensor. The accuracy results are impressive. Research shows the system has a mean absolute relative difference of just 8.8%. But what makes this even more remarkable is how well it works when glucose levels drop dangerously low. The system correctly detected low glucose levels 96.6% of the time at 70 milligrams per deciliter. For high glucose levels at 180 milligrams per deciliter, the detection rate was 98%. The enhanced clinical study followed 110 people with diabetes for a full year. An amazing 90% of the sensors worked perfectly for the entire 365 days. No serious side effects related to the device were reported during the entire study. The Eversense 365 only needs one fingerstick calibration per week after the first 2 weeks. The system also addresses one of the most frustrating problems with traditional monitors: compression lows. These are false alarms that happen when people sleep on their sensor, causing it to show dangerously low glucose readings when levels are actually normal. The Eversense 365 virtually eliminates these false alarms, giving people better sleep and less anxiety. The device has earned integrated CGM status from the FDA. This means it can work with insulin pumps as part of automated insulin delivery systems in the future. While no specific pump partnerships have been announced yet, the companies are working on these connections. Cost has always been a major barrier to continuous glucose monitoring. Traditional systems cost about $15 per day for all components. But when you add up the frequent sensor changes, failed devices, and medical visits for problems, the annual costs can be substantial. The year-long sensor could potentially reduce many of these ongoing expenses. Research shows that continuous glucose monitoring significantly reduces hemoglobin A1C levels compared to traditional fingerstick testing. In one study of 150 veterans, average A1C levels dropped by nearly 1 full percentage point when switching from fingersticks to continuous monitoring. The device also features on-body vibration alerts that work even when your phone isn't nearby. The transmitter uses a gentle adhesive designed to minimize skin reactions and can be changed daily if needed one. But the real breakthrough is that you can remove the transmitter for swimming or other activities and put it back on without any warm-up period or data loss. For people with diabetes, this represents freedom from the constant cycle of sensor changes, adhesive problems, and device maintenance that has defined continuous glucose monitoring until now. Instead of managing their monitoring technology every week or two, they can focus on using the information to make better health decisions.